Videos of medicos treating coronavirus affected patients have left people wondering how safe are our health workers. Remember, there have been several reports of potential shortage of masks and protective preventive equipment. It's an issue that has gathered political color as well, with the Congress President Sonia Gandhi writing to the Prime Minister claiming there was a need to ensure that health workers were fully protected. Anand Patel has the story on what is the reality, how protected are our health workers.
सर मेरे पास अभी सिंगल मास्क भी नहीं है, ना मेरे पास सैनिटाइजर है, फिलहाल ग्लव्स ही अवेलेबल है।
अच्छा,
लेकिन गाइडलाइंस के हिसाब से जो स्टॉक आना चाहिए था वो सिंगल पीस भी अभी पहुंच नहीं पा रहा है।
अभी तो स्थिति ठीक है, लेकिन 50% कम से कम शॉर्ट हो गया है आइटम।
अच्छा,
जो है हमारे पास वो बेच रहे हैं, पीछे से सप्लाई नहीं आ रहा। ठीक है, सब डिस्ट्रीब्यूटर मना कर रहे हैं कि हमारे पास स्टाफ नहीं है।
शॉर्टेज तो है इनकी, क्योंकि जब से गवर्नमेंट ने इसका रेट कंट्रोल करा है तो सारी सप्लाई चेन डिस्टर्ब हो गई है, तो फ्रेश स्टॉक होने में टाइम लग रहा है, तो इस वजह से थोड़ी सी शॉर्टेज है इसकी।
Amid the COVID-19 pandemic, pharmacies and hospitals have run short of personal protective equipments like gloves, masks and sanitizers. Most say that supply is not coming from wholesalers and warehouses, even though medicines and medical equipments are listed as essential goods.
just ahead of Sunday's lockdown, the government of India capped the price for sanitizers at rupees 50 for 100 ml and 3-ply masks at rupees 8 per piece. Now this price fixation has disrupted the supply chain of personal protective equipments.
There are fears the shortage could be artificially created by wholesalers.
Ever since the government of India has passed the price control order against the necessities like sanitizers and gloves and masks, some unscrupulous people have started hoarding them and not making them available, saying it as a short supply.
As per conservative industry estimates, 7.25 lakh body suits, 65 lakh N95 masks and at least 1 crore 3-ply masks were required in March alone. It was only last week the government of India banned their export. Shortage of safety equipment has left the healthcare professionals in a state of fear.
If we get the sudden rise in the infected patient in the country and where the government hospitals' capacity is exhausted, it will be required that private hospitals pitch in. Number of private hospitals have come forward that their hospitals can be taken over by the government.
The government, however, maintains there are enough stocks.
There was some issues, some bottlenecks in terms of their availability. Similarly, there were issues also related with respect to N95 masks because of the imported component. Government is aware of the issue. Interministerial effort have been going on to ensure that we can develop indigenous manufacturers. Those efforts are also now leading some good results.
The war on novel coronavirus can be won only if India's healthcare professionals are safe. If they too get infected, our one and only line of defense gets weakened. With Anand Patel in Delhi, Bureau Report, India Today.
So the big questions I want to raise tonight: how safe are our health workers? Do they have adequate protective gear to take on corona? Is the move to buy protective gear of the government a little late in the day? Does much more need to be done? These are some of the questions I want to raise with two top medical professionals. Professor K. Srinath Reddy, Doctor is President of the Public Health Foundation of India. Dr. Kunal Sarkar is Kolkata's leading surgeon, Chief Cardiac Surgeon, Senior Vice President of the Medica Super Speciality Hospital. Thank you both, gentlemen, for joining me at the moment. Various figures are doing the rounds about the need for mass protective equipment. Just today, a Reuters report based on Invest India seems to suggest India could need at some stage as much as 38 million masks to fight coronavirus, 6.2 million pieces of personal protective equipment. Professor Reddy, Dr. Reddy, do you believe that these figures are valid? Do you believe that there is a huge shortage of masks and personal protective equipment?
Well, based upon the numbers that are being projected in terms of the likely rise in patients, certainly we should be better prepared in terms of availability of masks and personal protection equipment. But some of the shortage that has been created, unfortunately, is because of the panic, which led to a lot of ordinary people on the street buying these masks for their own use, even if they didn't have any symptoms. Actually, a mask is required for a person who is having a problem so that they do not infect others. But if everybody else wants to wear a mask just to have the assurance that they're being protected, there is unfortunately a misutilization of the mask, and the people who really need it do not get it. So that is that's as far as the surgical masks are concerned.
Right.
As far as the N95 masks are concerned,
Yes.
certainly we will be requiring them in a larger number, and I think attempts are being made to procure them. And some groups, for example, our own Indian Institute of Public Health in Hyderabad, which has some public health engineers, are using 3D printers now to develop the printing of the mask, and that can possibly be also scaled up across engineering colleges as well as design institutes where 3D printers are available. So, but however, I believe possible as fast as possible, but we must make sure that they are given to the people who really need them, rather than everybody trying to use them for their own personal reassurance, even if they do not need them.
Let me just take that to Dr. Sarkar. Dr. Sarkar, do you believe that that is part of the problem? That those who really need them at the moment are not getting the mask? Or is there simply been again an element of lack of preparedness given the scale of the corona challenge, and the government was since January aware of what could happen?
Rajdeep, sadly, we cannot dissociate the anxieties of the individual from the magnitude of what is affecting the world and the country. So definitely the individuals will be in a state of anxiety and panic, and they will fortify themselves. But you just had a clip from Professor Girdhar Gyani, and in connection with that, I just want to highlight something which has got a lot of doctors, especially in the private sector in India, very, very sort of feeling very anxious and very vulnerable, because it is not just a lack of protective gear and the PPE and stuff like that, but it appears as if that the entire community of private doctors of each and every private hospital in India has been left outside the ambit of the special COVID insurance that has been announced by the center and also by the various state governments. And remember, if you follow the data of Italy, if you follow the data of United States, infectivity amongst doctors is high as 25%.
You're saying 25% of doctors can get infected based on Italy and America evidence and reportage. That's what you're saying.
Rajdeep, Italy has recalled more than 3,000 doctors who are COVID positive back to service simply because there is such a paucity of doctors there at this point of time. So to leave out the entire, almost half the population of the healthcare workers, doctors may have some insurance to back them up, health insurance. What about the people who are the nurses, who are in the transport sectors, who are the health technicians? So I implore and I request the government to consider to make the COVID insurance as comprehensive as possible. And on the front of the protective equipment and gear, the calculations right now suggest that should there be a significant disease burden, we are prone to face a shortfall of equipment, because this rings the memory of demonetization, that in spite of months of preparedness, at the last moment, just before we are at the height, at the brink of the stage 3, the eruption of the clinical disease, somewhere the writer doesn't know what the left hand is doing.
Let me just look at, you're saying that, let me for a moment look at just some of the numbers again. The government's purchase list, I've been flashing that on the screen. This is the official one, 2 HLL Life Care, which remember is the centralized agency handling this. CVN 95 masks, 40 lakhs required. Nitrile gloves, 20 lakh pairs. Protective goggles, 10 lakhs. Personal protective garment, 10 lakhs. Surgical masks, 2 crores. Hand sanitizers of 500 ml, 10 lakh. Viral transport medium, 5 lakhs. Now, these are large numbers, Dr. Reddy, there. And these numbers would suggest that you need to take this on a war footing. Did we wake up too late is a question that some are asking. On the other hand, does our public health system has its inadequacies that have existed for years now been exposed by just some of these numbers I'm referring to here?
Well, the numbers which are required will be based upon the number of patients who are likely to be admitted, which is going to be about 15 to 20% of the total cases that will happen to have the COVID infection. And these cases can actually require hospitalization over a period of time, depending upon the speed with which the epidemic advances. Therefore, it's difficult right at the very beginning to hypothesize how many people are likely to be infected, over what period, and what number would be requiring the hospitalization. But certainly, there is requirement of a fairly large number of these pieces of personal protection equipment. And if they were in short supply, certainly every attempt should be made to try and fill the gap as quickly as possible.
You know, Dr. Sarkar, is there a big gap between the private and the public hospitals where the public hospital doctors are actually more vulnerable? Those in government hospitals do not have the same facilities that maybe those in private hospitals have. We've had so far Telangana, a doctor couple test COVID positive. We've had 1 in Delhi, 3 in Mumbai, and 83 doctoral postdoctorate students in Patna, Bihar, who are suspected to be infected. Do you believe that there is a gap between private and public hospitals?
Rajdeep, that should not be the case really, because if you look at the recommendation where we are setting up the COVID hospitals, they would mostly come under the government system, both in the tier 1 and in the tier 2 cities. So there should not be this differentiation. And both in terms of health protection and in terms of insurance protection, we need to iron out the differences between the private and the public sector, and the sooner we do it, the better. And there is one more point I just want to raise briefly, which is the question of ventilators. Because should there be a flood of patients, then it is estimated that India requires 50,000 more ventilators.
Yes.
And there is some word going around that the automobile industry and etc. is coming into the business. But the fastest rate of making a ventilator is 500 per year. At this rate, to make 50,000 ventilators will take us 9 years.
But Dr. Sarkar, this is not just true of India. It's, you know, America is also facing a crisis of ventilators. So is Italy, so is Spain. So it's not unique to India, is it?
Absolutely right. No, Rajdeep, absolutely right. So the question is, instead of cooking up numbers which will only mislead us, we need to have realistic preparedness for this battle. That is what is important.
Do you believe, therefore, Dr. Reddy, Professor Reddy, that this is a wake-up call? That in a sense, what we are seeing, Professor Reddy, this is the ultimate wake-up call for a system that perhaps has not invested in the past enough in providing this kind of protective equipment.
I entirely agree that we should be much better prepared for all contingencies, including even some unanticipated public health emergencies like this. But specifically on the issue of ventilators, as has been pointed out, every country is facing that very critically. But we have had some ray of hope today, where the DRDO, which had previously developed a ventilator, the defense section, has now announced that they will be actually stepping up the production of ventilators now and will be supplying a fairly large number, almost 30,000 ventilators would be coming from them. That's the announcement that's been made. Now, obviously, other industrialists also have offered the same. Procuring ventilators from outside would be a matter of challenge because every single country, UK, US, and European countries are also vying for them. But while we are still trying to procure ventilators from abroad, I think we must try and divert our own engineering strength into producing these in much larger numbers.
Right.
And there are also some low-cost ventilators which are available, which have also been indigenously developed by some innovators. We should try and explore them and see whether in some cases they can also be used. But certainly there's a great need for shoring up our resources.
Well, gentlemen, doctors, I think what we are seeing is perhaps different pressure points on the system, including the public health system, and at the front line of that are our doctors, our paramedics and our nurses. They need to be fully equipped to fight this battle. Dr. Sarkar, Professor Reddy, appreciate your joining me today with your thoughts here on that serious issue.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.